Welcome students to EPG Pathshala. I am Vimla Nadkarni, retired professor from Tata Institute of Social Sciences and immediate past president of the International Association of Schools of Social Work. I am presenting the module titled Sustainable Development Goals and Mental Health, which is part of the course of mental health and the subject of social work. I'll start with the objectives and then go on to the content and end with a summary. So the objectives of this module are that students should understand the context and content of Sustainable Development Goals, meaning of sustainable development as articulated in the SDGs Agenda 2030. Students should also understand the importance of mental health and well-being for sustainable development, and you also need to know the role of stakeholders in developing related policy and programs. For the first time, world leaders are recognizing the promotion of mental health and well-being and the prevention and treatment of substance abuse as health priorities within the global development agenda. The inclusion of mental health and substance abuse in the Sustainable Development Agenda is expected to have a positive impact on communities and countries where millions of people will receive much needed help. SDGs for 2030 provide policy and action pathways for transforming the world to attaining sustainable development globally by 2030. And they were developed by the United Nations and adopted as the 2030 Agenda for Sustainable Development at the UN Summit on Sustainable Development on 25th September 2015. They build on the Millennium Development Goals and replace them from January 1st, 2016. What is the agenda? What does it contain? The agenda is a plan of action for people, planet, and prosperity and seeks to strengthen universal peace in larger freedom. The critical areas for intervention are summarized as 5 P's, namely people, planet, prosperity, peace, and partnership. The agenda provides 17 SDGs, that is Sustainable Development Goals, and 169 targets in a balanced and integrated manner, focusing on economic, social, and environmental dimensions of sustainable development. The agenda reiterates the realization of human rights for all, achievement of gender equality, and improvement of women and girls. Health is centrally positioned within the 2030 Agenda with one comprehensive goal, that is the SDG 3, and its 13 targets covering all major health priorities and links to targets in many of the other goals. And the improvement over the Millennium Development Goals is the inclusion of mental health, suicide, and substance abuse, including alcohol use, under the broad classification of non-communicable diseases. Goals 2 and 3 focus on food security, nutrition, healthy lives, and promotion of well-being for all at all ages. What is the importance of mental health and well-being for sustainable development? Mental health and sustainable development are integrally related. Mental health is an issue in all countries of the world, and especially in the low-income and developing countries where health services are not given much importance in terms of allocation of resources and also setting up of services. The issue of mental health in India, for example, is recently recognized. There have been lot of activities, a lot of advocacy efforts from NGOs, from civil society to convince the government to allocate more resources on mental health, because mental health disorders in our country, they cover about 10% of our population. And if you look at the common mental health disorders, whether it's anxiety or neurosis, the number of people having these problems would increase. The lack of importance given to mental health on the global agenda was evidenced by the very low levels of investment in health budgets of less than 1% in countries in Africa and Southeastern Asia, and less than 1% of development assistance for mental health care services. Mental and psychosocial disabilities, including neurological and substance use disorders, affect 1 in 4 people over their lifetime and 1 in 10 at any given time, and thus harm billions of lives globally. These disorders are the leading cause of disability worldwide, accounting for high levels of premature death and low productivity. Depression and anxiety are the most common and are estimated to affect nearly 1 in 10 people on the planet, that is 676 million, often leading to suicide. Globally, among young adults aged 15 to 29 years, suicide accounts for 8.5% of all deaths and is the second leading cause of death in this group after road traffic injuries. Substance use and substance use disorders, including the harmful use of alcohol, cause a significant public health burden. In 2010, 38% of the world's population aged 15 or older had drunk alcohol in the past 12 months, with 16% of them engaged in heavy episodic drinking. The symbiotic relationship between mental health and sustainable development is finally being recognized by the global leaders. Although it is included under the area of non-communicable diseases in the Sustainable Development Goals agenda of the UN, it is still seen as a positive step forward. The SDG with 13 targets covers all major health priorities. So for the first time, world leaders are recognizing the promotion of mental health and well-being and prevention and treatment of substance abuse as health priorities within the Global Development Agenda. SDG 3 includes targets for the reduction of non-communicable disease-related mortality and promotion of mental health, for reducing substance abuse, including the harmful use of alcohol, reduction of deaths and illnesses from air pollution, and for tobacco control. Mental health cannot be ignored or be given less importance, as it is inextricably linked to sustainable development, either as an outcome or a determinant. The poor and extreme poor in limited resource settings, deprived of basic rights of food, shelter, employment, water, sanitation, and a sustainable, unpolluted environment, are the most marginalized and vulnerable. There is also a very close relationship, as studies have shown, between poverty and mental health. So those who are poor, who are struggling for their life, who are struggling for their basic rights, and their basic rights are not protected, they are the ones who are most likely to go into depression, anxiety, neurosis, and even suicide. Their suffering is aggravated by the lack of mental health services, as governments are reluctant to recognize this as a major burden of disease. Development of people means access to all basic services and basic rights, whether it is shelter, whether it is food security, or health services or social services. People for their well-being need to have access to all their basic services, as well as, of course, livelihood. Working is seen. Those who work, they have better mental health compared to those who don't work. In fact, studies have shown that even those who have mental health problems, if they are uh, employed and they earn their own living, they have a better self-image, and they are able to manage their life much better and also get the support of their family. So government, because of the persistent pressures of the NGOs and civil society, and in our country, the National Institute of Mental Health and Neurosciences has also played a very, very major role in getting the Indian government to initiate a national mental health program and also a national mental health policy. The Indian government, for example, spends less than 1% of GDP on healthcare. There are also urban and rural differences which we have to understand. Maybe in the rural areas, the mentally challenged people are better accepted because the expectations are low. But in the urban areas, there is much more expectation from the urban populations, and people are less likely to be productive. However, we also know that services tend to be focused or concentrated more in the urban than the rural areas. So development therefore means that it has to be holistic, uh, and has to relate to both the physical and mental health of the individual and the community. So what is the role of international policy and advocacy documents, and how did this recognition of mental health as a developmental issue come about in the global agenda? The UN DESA WHO policy analysis advocated for recognizing mental health as a developmental issue. The Convention on Rights of Persons with Disabilities 2006 highlighted the importance of the nexus between disabilities and mental health in the context of human rights, humanitarian activities, and in development work. The next document that has had an influence is the Ministerial Declaration on implementing the internationally agreed goals and commitments in regard to global public health. Economic and Social Council in July 2009 highlighted the importance of integrating mental health in the MDGs and other internationally agreed development goals and commitments. The World Health Organization has also played a very, very major role in showcasing mental health as an important global agenda. It provided policy and programmatic guidance on inclusion of mental health for sustainable development through its Mental Health Gap Action Program and the landmark Mental Health and Development Report. All these documents are available on their website. The UNFPA, that is the United Nations Population Fund, collaborated with the WHO in the development of tools on integrating mental health into maternal, sexual and reproductive health, youth health, and emergency response programs. The United Nations Development Program has started integrating mental health and psychosocial aspects into its programs through supporting improved mental health systems, developing capacity related to mental health among development partners and community workers, and by raising awareness at the grassroots on mental health in the context of poverty reduction, crisis prevention and recovery. The UNICEF, that is the United Nations Children Fund, has begun to integrate a psychosocial perspective in its activity areas such as protection, education and child development among others. UNICEF has been increasingly active in providing psychosocial support in and after emergencies and expanding to broader development efforts. The UNESCO integrates aspects of psychosocial well-being into its education programs. Bilateral agencies are also supporting mental health programs in various low-income countries. Now we will talk about the role of stakeholders in formulating related policy and programs. All stakeholders, ranging from civil society to governments, have significant roles to play in developing indicators, formulating appropriate policy and effect action plans to ensure that citizens affected by mental and psychosocial disorders or disability are reached with adequate investments in their health budgets. Collaboration and coordinated efforts among the stakeholders, including people's participation, will enable and ensure that mental health is promoted and mental and psychosocial disorders, disability are prevented. This in turn would be an investment in sustainable development. So we will now look at the different examples of stakeholders and the roles that they can play in enhancing mental health services, in prevention, promotion, and helping people gain access to the services. We have civil society as one of the important stakeholders that can organize advocacy programs and services to support people with mental and psychosocial disabilities to access resources and integrate in the community. The governments are encouraged to create enabling environments to reduce stigma and discrimination, promote human rights, and improve quality and quantity of health education, social services, and poverty alleviation programs. The role of academic institutions is in building capacities of policymakers, planners, and service providers in the mental health field, and to generate and synthesize research for policy development. Bilateral agencies and international funding organizations advocate for including mental health in national development and sectoral plans and ensure that targeted projects with development outcomes address needs of people with mental health conditions. The United Nations and other multilateral organizations advocate for repositioning of mental health issues in national agendas, allocation of adequate resources to mental health, ratification and implementation of UN Convention on the Rights of Persons with Disabilities, recognition of people with mental and psychological disorders as a vulnerable group, and mental health to be mainstreamed in sectoral policies. To summarize this module, I have covered the importance and integration of mental health issues in the UN's 2030 Agenda for Sustainable Development Goals, and shown the comparison of these Agenda 2030 to the MDGs, which did not pay attention to mental health. The SDGs have, however, included mental health and psychosocial disabilities, substance abuse, including alcohol abuse, under the broad category of non-communicable diseases. This is viewed as a progressive step in view of the fact that most countries, especially in Africa and Southeast Asia, have allocated very few resources for health in general, neglecting people with mental and psychosocial disabilities, although they are recognized as a marginalized and vulnerable group. The Sustainable Development Goals thus call on governments to allocate more resources to prevent mental health problems and for providing greater access to health, education, social services, as well as reduce stigma and discrimination and protect the human rights. One of the major problems that are faced by those with mental health problems, mental disorders or mental illness is stigma and discrimination. And with stigma and discrimination, people are not encouraged then to lead a normal life. Even not only are those living with mental illness affected, but even their caregivers, their families, the neighborhood, the community is affected. Even those who work with the mentally ill people, those who, the hospital staff, there is stigma attached to those who are treating mentally disturbed people. And this is this discourages normalization of the process, and it also discourages mainstreaming of an understanding of mental health within society. So it is so important that mental health is accepted as a very important part of health of the individual and for well-being of the individual. Without mental health, the individual cannot function, the person cannot work, or a child will not be able to cope with the school, will not be able to relate to others, and is emotionally out of control. So there are all these aspects of a mentally unhealthy person which stops their productivity. It is very important that all adults work. They earn for themselves, they earn for their families, they are able to look after their children. But if they are down with a mental health problem, they are not able to function like normal workers. This means that the more the mentally unhealthy people in a community or a country, the lower will be the productivity. The module also briefly covers international policy documents that have advocated the inclusion of mental health in SDGs and the role of stakeholders in addressing mental health issues and advocacy. References, and you can look at the references at the end of this module, as well as the e-text and enhance your knowledge about this chapter. Thank you very much.